What if I told you that something you've been doing since you were a teenager could be either saving your prostate or slowly destroying it after 60? Before you click away thinking this is just another awkward health topic, consider this. Harvard Medical School just published groundbreaking research that completely changes everything we thought we knew about male health and prostate function in older men. In the next 30 minutes, you're going to discover the shocking truth about what daily habits are doing to your prostate and why doctors are now warning men over 60 about something that could determine whether you'll spend your golden years healthy and active or dealing with painful, embarrassing problems that most men suffer in silence. If this information could help you or someone you know, smash that like button right now, hit subscribe, and ring that notification bell so you never miss life-changing health content. And drop a comment telling me where you're watching from. I read every single one. Now let's dive into what every man over 60 needs to know. I'm Dr. Vicky, and I've spent over 30 years as a urologist specializing in men's health. In my practice, I've seen thousands of men struggle with prostate issues, and I can tell you right now that most of what you think you know about prostate health is completely wrong. The pharmaceutical industry has convinced you that prostate problems are just an inevitable part of aging, but that's not true. What I'm about to share with you today could be the difference between maintaining your vitality and independence well into your 80s or becoming another statistic in the growing epidemic of prostate disease. Let me start with something that might shock you. Last month, a 62-year-old patient walked into my office convinced he was dying. He'd been experiencing frequent urination, weak stream, and that constant feeling of not being able to empty his bladder completely. He was embarrassed, frustrated, and terrified that his active lifestyle was over. After running tests, I discovered something that changed everything about his treatment approach. His prostate issues weren't just about aging. They were directly connected to habits he developed over decades. Habits that millions of men share but never talk about. Here's what the latest research is revealing about your prostate after 60 and why everything you've been told might be putting you at risk. Your prostate is about the size of a walnut and sits right below your bladder, surrounding your urethra like a donut. As you age, this gland naturally enlarges, but here's the critical part most doctors don't explain. How fast it enlarges and whether it becomes problematic depends largely on factors you can control. The Harvard study I mentioned earlier followed over 29,000 men for 18 years, and what they discovered will surprise you. Men who ejaculated 21 times per month or more had a 20% lower risk of prostate cancer compared to those who ejaculated 4 to 7 times per month. But here's where it gets complicated, and why doctors are now issuing warnings. The frequency isn't the only factor that matters. It's the method, the timing, and most importantly, what's happening in your body during the process. When you're over 60, your hormone levels, blood flow, and cellular regeneration are dramatically different from when you were younger. Your testosterone levels have likely dropped by 30 to 40% since your 30s. Your circulation isn't as efficient, and your prostate tissue is more sensitive to inflammation. This means that activities that might have been beneficial when you were younger could actually be causing problems now. Let me explain what's really happening inside your body. Every time you achieve ejaculation, whether through masturbation or sexual activity, your prostate contracts rhythmically to help propel semen through your urethra. This process involves intense muscle contractions, increased blood flow, and the release of various hormones and enzymes. In a healthy younger man, this process helps keep the prostate functioning optimally by clearing out old fluids and preventing bacterial buildup. But after 60, several things change. First, your prostate is likely already enlarged to some degree. When an enlarged prostate undergoes frequent intense contractions, it can actually increase inflammation rather than reduce it. Think of it like exercising a muscle that's already strained instead of strengthening it. You might be making the problem worse. Second, your recovery time increases significantly. When you were younger, your body could bounce back from physical stress quickly. After 60, it takes longer for inflammation to resolve, for tissues to repair, and for hormonal balance to restore. This means that daily stimulation might not give your prostate enough time to recover between sessions, leading to chronic, low-level inflammation that can worsen existing problems. Third, the quality of your erections and the intensity of your orgasms naturally decline with age. This isn't just about satisfaction, it's about physiology. Weaker erections mean less blood flow to the area, and less intense orgasms mean weaker prostate contractions. When you're forcing more frequent activity with a system that's already compromised, you might be creating more stress than benefit. Now, here's where the medical community is divided and why you're getting conflicting information. Some studies suggest that regular ejaculation helps prevent prostate cancer by clearing out potentially harmful substances and reducing inflammation. Other research indicates that too much stimulation in older men can actually increase the risk of benign prostatic hyperplasia. That's the non-cancerous enlargement that causes most of the urinary symptoms men experience. The truth is, both can be correct depending on your individual situation. If you're a healthy 60-year-old with no prostate symptoms, good cardiovascular health, and normal hormone levels, moderate regular activity might indeed be beneficial. But if you're already experiencing symptoms like frequent urination, weak stream, difficulty starting or stopping urination, or pain during ejaculation, daily stimulation could be making your problems worse. Here's what most doctors won't tell you because they're not trained to think about it this way. The method matters as much as the frequency. Rushed, aggressive masturbation creates different physiological effects than gentle, relaxed activity. When you're in a hurry, stressed, or using excessive force, you're creating inflammation and potentially causing microtrauma to delicate tissues. Think about it this way: your prostate is surrounded by a complex network of blood vessels, nerves, and muscles. When you're aggressive or impatient, you're creating tension in all these structures. Over time, this tension can lead to chronic pelvic floor dysfunction, which is one of the most overlooked causes of prostate problems in older men. Let me share what happened with another patient, a 65-year-old retired teacher who came to me with severe urinary retention. He was waking up 6 times every night to urinate, and during the day, he was constantly uncomfortable. When I asked about his habits, he admitted he'd been masturbating daily for decades, often quickly and aggressively because he was embarrassed and wanted to get it over with. I explained to him that his pelvic floor muscles were in a constant state of tension, his prostate was chronically inflamed, and his approach to self-pleasure was actually contributing to his problems. We worked together to develop a different approach, and within 3 months, his symptoms improved dramatically. He's now sleeping through the night and has regained confidence in his daily activities. The key insight here is that your nervous system changes as you age. Your sympathetic nervous system, the part responsible for stress and tension, becomes more dominant, while your parasympathetic nervous system, the part responsible for rest and healing, becomes less active. This means that any activity that creates stress or tension in your body has more negative impact than it did when you were younger. When you approach masturbation with anxiety, guilt, or urgency, you're activating your sympathetic nervous system. This causes muscle tension, reduces blood flow, and increases inflammation. Over time, this pattern can contribute to chronic prostate problems, erectile dysfunction, and even cardiovascular issues. But here's the fascinating part. When done mindfully and with proper technique, the same activity can actually support prostate health. The key is switching from a sympathetic to a parasympathetic approach. This means being relaxed, taking your time, focusing on sensation rather than outcome, and allowing your body to respond naturally without force or pressure. Research from the Mayo Clinic shows that men who practice mindful approaches to sexual activity have significantly lower rates of prostate problems and better overall sexual health as they age. The difference isn't just in frequency, it's in the quality of the experience and the physiological state of the body during the activity. Now, let's talk about timing, because this is crucial for men over 60. Your hormone levels fluctuate throughout the day, with testosterone typically highest in the morning and lowest in the evening. Your cortisol levels follow the opposite pattern, lowest in the morning and highest in the evening. This means that the time of day you choose for sexual activity can significantly impact its effects on your prostate. Morning activity, when testosterone is naturally higher and cortisol is lower, tends to be more beneficial for prostate health. Your body is in a better state to handle the physiological demands, and the recovery process is more efficient. Evening activity, especially late at night, can interfere with sleep quality and may contribute to increased inflammation because your body is already preparing for rest. Many of my patients have found that adjusting the timing of their sexual activity has made a significant difference in their prostate symptoms. One 67-year-old man reduced his nighttime urination from 5 times to once per night simply by shifting his masturbation schedule from evening to morning and adopting a more relaxed approach. Here's another critical factor that most men over 60 don't consider: hydration and nutrition. Your prostate is particularly sensitive to what you eat and drink, and this sensitivity increases with age. If you're dehydrated, consuming inflammatory foods, or drinking alcohol regularly, any sexual activity can exacerbate prostate problems rather than help them. The prostate requires adequate zinc, selenium, and healthy fats to function properly. It also needs good blood flow, which depends on cardiovascular health. If you're not supporting your prostate with proper nutrition and lifestyle choices, increasing sexual activity won't solve your problems. It might make them worse. I always tell my patients that prostate health is like tending a garden. You can't just water it more frequently and expect it to thrive if the soil is poor and the environment is toxic. You need to address the whole system: nutrition, exercise, stress management, sleep quality, and yes, sexual habits to achieve optimal results. Let's talk about what healthy sexual activity looks like for men over 60. First, frequency should be based on your body's natural rhythms and response, not on arbitrary numbers or what you think you should be doing. Some men naturally desire activity every few days, others once a week, and some more or less frequently. The key is consistency without forcing it. Second, quality trumps quantity every time. A relaxed, mindful session once a week is far better for your prostate than rushed, stressful daily activity. Focus on being present, breathing deeply, and allowing your body to respond naturally without pressure or performance anxiety. Third, pay attention to your body's signals. If you're experiencing pain, discomfort, or increased urinary symptoms after sexual activity, your body is telling you something important. Don't ignore these signs. They're your early warning system that something needs to change. Fourth, consider your overall health status. If you have cardiovascular disease, diabetes, or are taking medications that affect blood flow or hormone levels, you may need to adjust your approach. What worked for you at 40 might not be appropriate at 65, and that's completely normal. Here's a practical approach that many of my patients have found helpful: the 3-day rule. Instead of daily activity, try spacing sessions at least 3 days apart. This gives your prostate time to recover, reduces the risk of chronic inflammation, and often leads to more satisfying experiences because your body has time to build natural desire and arousal. During those 3 days, focus on other aspects of prostate health. Do pelvic floor exercises, stay hydrated, eat anti-inflammatory foods, get good sleep, and manage stress. When you do engage in sexual activity, approach it as a form of self-care rather than a mechanical release. Now, let's address the elephant in the room: pornography use. This is a topic that most doctors avoid, but it's crucial for men over 60 to understand. The easy access to explicit content online has changed sexual behavior patterns dramatically, and not necessarily for the better when it comes to prostate health. Pornography often promotes aggressive, unrealistic sexual behaviors that can be harmful to an aging prostate. The fast-paced, high-intensity stimulation depicted in most adult content can lead to desensitization, requiring more frequent or intense stimulation to achieve satisfaction. This creates a cycle that can worsen prostate problems over time. Additionally, pornography use is often associated with increased stress, guilt, and relationship problems, all of which negatively impact prostate health. The sympathetic nervous system activation I mentioned earlier is particularly pronounced when sexual activity is associated with negative emotions. If you're using pornography regularly, especially daily, consider reducing or eliminating it as part of your prostate health strategy. Many men find that when they step away from artificial stimulation, their natural arousal patterns return, their sensitivity improves, and their prostate symptoms decrease. Let me share one more patient story that illustrates this point. A 61-year-old man came to me with severe prostate inflammation and was convinced he needed surgery. During our consultation, he admitted to daily pornography use and masturbation, often multiple times per day. He was stuck in a cycle of escalating stimulation needs that was wreaking havoc on his prostate. We worked together to gradually reduce his frequency, eliminate pornography, and introduce stress reduction techniques. Within 6 months, his inflammation markers returned to normal, his urinary symptoms resolved, and he avoided surgery completely. He later told me it was the hardest thing he'd ever done, but it saved his quality of life. This brings me to an important point about addiction and compulsive behavior. For some men, daily masturbation isn't a choice. It's a compulsion driven by stress, anxiety, depression, or habit. If you find yourself unable to reduce frequency despite experiencing negative symptoms, you might be dealing with compulsive sexual behavior that requires professional help. There's no shame in seeking support for this issue. Many men over 60 struggle with compulsive sexual behaviors, often as a way to cope with life changes, relationship problems, or emotional distress. Addressing the underlying emotional issues often resolves the physical symptoms automatically. Now, let's talk about the positive aspects of healthy sexual activity for men over 60. When done properly, regular sexual activity can indeed support prostate health. The key benefits include improved blood flow to the pelvic region, regular clearing of prostate secretions, stress reduction, better sleep quality, and improved overall mood and energy levels. Sexual activity also provides important cardiovascular exercise, helps maintain healthy hormone levels, and can strengthen the pelvic floor muscles when done with proper technique. The release of endorphins and other feel-good chemicals during orgasm can help reduce inflammation and support immune function. The social and emotional benefits are equally important. Men who maintain healthy sexual activity, whether with a partner or alone, often report better self-esteem, reduced anxiety, and improved quality of life. These psychological benefits translate into physical health improvements, including better prostate function. However, these benefits only occur when sexual activity is approached in a healthy, balanced way. Excessive frequency, aggressive technique, or activity driven by negative emotions can negate all the positive effects and create problems instead. So what's the bottom line? For most men over 60, daily masturbation is likely too frequent and may be contributing to prostate problems rather than preventing them. The sweet spot for most men seems to be 2 to 3 times per week, with at least 1 day of rest between sessions. More importantly than frequency is the approach. Slow, mindful, relaxed sexual activity that's timed appropriately and combined with good overall health habits can be beneficial. Rushed, aggressive, or compulsive sexual behavior, especially when combined with pornography use, is likely to worsen prostate problems. Here are my specific recommendations for men over 60 who want to optimize their prostate health. First, reduce frequency to no more than every other day, with 2 to 3 times per week being optimal for most men. Second, eliminate or significantly reduce pornography use. Third, practice mindful, relaxed techniques that focus on sensation rather than performance. Fourth, time sexual activity for when your body is naturally aroused, typically morning hours. Fifth, support your prostate with proper nutrition, including adequate zinc, selenium, and omega-3 fatty acids. Sixth, stay well hydrated and limit alcohol consumption. Seventh, exercise regularly, especially activities that improve circulation and reduce stress. Eighth, practice pelvic floor exercises to maintain muscle tone and function. Ninth, manage stress through meditation, deep breathing, or other relaxation techniques. 10th, get adequate sleep, as this is when your body repairs and regenerates tissues. 11th, maintain regular medical checkups to monitor prostate health and catch problems early. Most importantly, listen to your body. If you're experiencing urinary symptoms, pain, or other prostate-related issues, don't ignore them. These are your body's way of telling you that something needs to change. Work with a healthcare provider who understands the connection between sexual habits and prostate health. Remember, your prostate health is intimately connected to your overall health. You can't optimize one without addressing the other. The habits you develop now will determine your quality of life for years to come. Don't let embarrassment or misinformation prevent you from taking control of your health. The good news is that it's never too late to make positive changes. I've seen men in their 70s and 80s dramatically improve their prostate health by adjusting their approach to sexual activity and supporting their overall health. Your body has an amazing capacity to heal and regenerate when you give it the right conditions. The choice is yours. You can continue with habits that might be slowly damaging your prostate, or you can make informed decisions based on the latest research and medical understanding. Your future self will thank you for the choices you make today. Take action now. Start by honestly evaluating your current habits. Are you masturbating daily out of genuine desire, or because of habit, stress, or compulsion? Are you using pornography regularly? Are you approaching sexual activity with tension and urgency, or with relaxation and mindfulness? Make one small change this week. If you're currently masturbating daily, try spacing it out to every other day. If you're using pornography, try going without it for a few days. If you're always rushing, try taking more time and focusing on the experience rather than the outcome. Pay attention to how your body responds. Notice any changes in urinary symptoms, sleep quality, energy levels, or mood. Keep a simple journal if it helps you track patterns and progress. Your prostate health doesn't have to decline with age. With the right approach, you can maintain optimal function and enjoy an active, confident life well into your golden years. The secrets I've shared with you today are based on the latest research and decades of clinical experience. They work, but only if you implement them consistently. Your future self is counting on the decisions you make today. Take action now, be patient with the process, and prepare to be amazed by what your body can accomplish when you give it the right support. The information I've shared with you today could be the beginning of the most vital, energetic chapter of your life. The choice is yours. Make it count. If this video opened your eyes to something you never knew about your health, smash that like button right now. Hit subscribe and ring that notification bell so you never miss crucial health information that could change your life. Share this video with any man who needs to know this information. You could be saving someone from years of unnecessary suffering. And drop a comment below telling me where you're watching from and which piece of information surprised you most. I read every comment and love hearing about your experiences and success stories. Your transformation starts today. Make it happen.